Every man, no matter his age, background, or lifestyle, deserves to understand his own sexual health. It is one of the most private, yet most important, parts of a man's well-being. Many men avoid talking about it because they feel shy, embarrassed, or unsure of what is normal. In this video, we will talk about the different ways we can adjust our habits to better this situation. My name is Dr. Sofia Carter. Here at the Kisney Center, we create informative videos every week. If you enjoy our content, please subscribe to our channel and pass it along to your friends and family members. But the truth is, knowing how your body works and how to take care of it can change your entire life. It can improve not only your sexual performance, but also your confidence, relationships, and overall health. Sexual health is not only about sex. It is about your body's ability to function properly, your hormones, your mental state, your emotions, and even your lifestyle habits. When something goes wrong with sexual health, it can sometimes be an early warning sign of other problems in the body such as diabetes, heart disease, or stress. That's why learning about this topic is not only about pleasure, it's about health, balance, and self-care. A man's sexual health depends on many things working together. It includes the brain, the nervous system, the blood vessels, the hormones, and the reproductive organs. When any part of this system is disturbed, it can affect everything else. For example, if a man is always stressed, his brain releases chemicals that reduce his sexual desire and lower his testosterone levels. If his blood circulation is poor, it can lead to weak erections. If his diet is unhealthy or he drinks too much alcohol, it can harm sperm production. Understanding your body is the first step. Inside every man's body, the testicles are like small factories that make sperm and testosterone. Sperm are tiny cells that carry the genetic material needed to fertilize a woman's egg. Testosterone is the main male hormone that helps build muscle, grow facial hair, deepen the voice, and maintain sex drive. It also affects mood and energy levels. When testosterone levels drop too low, men often feel tired, lose interest in sex, and may even feel sad or irritable. Many men don't realize that lifestyle choices affect testosterone. Smoking, alcohol, poor sleep, lack of exercise, and obesity can all reduce hormone levels. Simple habits like sleeping 7 to 8 hours, eating protein and healthy fats, and staying active can keep testosterone in a healthy range. The body makes most of its testosterone in the early morning, which is why many men notice stronger erections when they wake up. Sexual health is also connected to mental health. A man's thoughts, emotions, and self-image can directly influence his sexual performance. Anxiety and depression are two major causes of erectile problems. When a man worries too much about performance, he activates the body's stress system, which tightens blood vessels and prevents normal arousal. That's why relaxation, mindfulness, and communication with a partner are essential. Relationships play a huge role as well. Sexual health is not just a physical thing. It is emotional and relational. Many men think that performance is all that matters, but true intimacy involves trust, communication, and respect. A man who listens, who understands consent, and who values emotional connection is far more sexually healthy than one who focuses only on physical pleasure. Now, let's talk about common issues that men face. The most frequent concern is erectile dysfunction, often called ED. It means having trouble getting or keeping an erection firm enough for sex. ED can happen for many reasons. Sometimes it's temporary, caused by stress, fatigue, or alcohol. But if it happens regularly, it can signal deeper health issues such as high blood pressure, heart problems, or diabetes. That's because erections depend on healthy blood flow. If the arteries are blocked, the penis can't fill with blood properly. So, ED can sometimes be the first sign that something is wrong with your heart or circulation. Another common issue is premature ejaculation, when a man finishes too early during sex. This can be frustrating and affect confidence, but it's actually very common and treatable. Sometimes it happens because of anxiety or over-sensitivity. Learning techniques to relax, communicate with your partner, and even using certain medical treatments can help control timing. Some men experience low libido or reduced sexual desire. This can be caused by stress, low testosterone, lack of sleep, or even emotional disconnection. A healthy sex drive usually returns when lifestyle and emotional factors improve. One of the most ignored topics is sperm health. Many men don't think about it until they try to have children. Healthy sperm are needed for fertility, but sperm quality can be affected by many things: heat, tight clothing, smoking, alcohol, and even mobile phones kept in the pocket for long hours. Sperm are very sensitive to temperature, which is why the testicles hang outside the body in the scrotum. If the temperature rises too much, sperm production can decrease. Eating well helps improve sperm quality. Foods rich in zinc, vitamin C, vitamin D, and antioxidants support sperm count and motility. Fresh fruits, vegetables, nuts, fish, and eggs are excellent choices. Avoiding processed foods, sugary drinks, and trans fats can make a big difference. It's also important to talk about sexually transmitted infections, or STIs. Many men think they are safe just because they feel healthy, but some infections show no symptoms. Chlamydia, gonorrhea, HIV, and syphilis can spread through unprotected sex. Using condoms and getting tested regularly are simple, but powerful ways to protect yourself and your partner. Even in committed relationships, testing together builds trust and safety. Good hygiene is another key part of sexual health. Washing regularly, keeping the genital area clean and dry, and wearing breathable underwear help prevent infections. Uncircumcised men should gently clean under the foreskin daily to remove any buildup of bacteria or secretions that can cause irritation. Some men feel uncomfortable visiting a doctor for sexual problems, but it is one of the smartest things they can do. Doctors who specialize in men's health or urology understand these issues and treat them confidentially. Many problems are easily curable with medicine, lifestyle change, or simple therapy. Ignoring symptoms only makes them worse. Another thing every man should understand is that sexual performance naturally changes with age. Testosterone levels start to drop slowly after the age of 30. Erections might not be as strong or as frequent as before, and it can take longer to become aroused. This is normal and not something to feel ashamed about. Regular exercise, a healthy diet, and staying emotionally close with your partner can help maintain a satisfying sex life well into older age. Exercise is one of the best medicines for sexual health. Physical activity improves blood circulation, strengthens the heart, reduces stress, and boosts testosterone. Even simple activities like walking, jogging, or cycling for 30 minutes a day can make a difference. Strength training, such as lifting weights, helps increase testosterone levels and improves stamina. Sleep is equally important. When you don't get enough rest, the body produces more stress hormones like cortisol, which lowers testosterone and reduces libido. Men who sleep only 4 or 5 hours a night have been shown to have testosterone levels similar to someone 10 years older. So, getting enough sleep is not just about energy, it's about keeping your sexual system working properly. Let's not forget about mental peace. Many men live under pressure, financial worries, job stress, or relationship conflicts. This constant stress can shut down desire and make it hard to perform. The brain needs to feel safe and relaxed to experience pleasure. Taking time to unwind, meditate, or simply breathe deeply before intimacy can calm the body and improve performance naturally. Communication with your partner is another powerful tool. Being open about needs, fears, or difficulties makes intimacy stronger. Many men try to hide their problems out of shame, but partners often appreciate honesty. Discussing issues calmly and respectfully reduces anxiety and helps both partners feel more connected. One more point is the importance of regular medical checkups. Many sexual health issues are linked to silent conditions like high cholesterol, diabetes, or obesity. A simple blood test can reveal hormone levels, sugar levels, and other vital signs that affect sexual function. The earlier these problems are found, the easier they are to fix. Men should also remember that sexual health is not only about function, it's about safety, consent, and respect. Understanding boundaries, using protection, and respecting your partner's comfort are all signs of a truly healthy man. Healthy sexuality is built on care, empathy, and understanding, not pressure or performance. Some men worry about size, comparing themselves to unrealistic images online, but sexual satisfaction rarely depends on size. What truly matters is intimacy, connection, and emotional presence. Studies show that communication and affection are far more important for pleasure than physical appearance. Modern life also brings challenges that older generations didn't face. Pornography, for example, is easily available and can shape unrealistic expectations about sex. When men consume too much porn, they can become desensitized or develop performance anxiety. Some even experience porn-induced erectile dysfunction, where real intimacy no longer feels exciting. Reducing or avoiding porn can help reset the brain's natural response to real partners. Exploring men's sexual health, it's important to remember that this topic is not only about the physical body, but about the full picture of a man's life. Everything is connected. Your mind, your diet, your emotions, your relationships, and your habits all influence how your body performs. Sexual health is not built overnight, it's built through daily choices, understanding, and awareness of what helps or harms you. Many men never take the time to think about how simple lifestyle decisions affect them years later, but every choice matters. Let's start with something that may surprise many men. The food you eat directly affects your sexual performance and fertility. The body's sexual system relies heavily on blood flow, hormones, and nerve function. And all of these are influenced by nutrition. A diet high in processed foods, sugar, and saturated fat can clog arteries, reduce blood circulation, and lower testosterone. This not only affects erections but also sperm health. On the other hand, eating whole, natural foods nourishes the body and keeps the system working efficiently. Men should try to include foods that naturally boost testosterone and circulation. Oily fish like salmon, sardines, and mackerel provide omega-3 fatty acids that help blood vessels stay flexible. Eggs and lean meat give protein and zinc, which are vital for sperm production. Fruits like bananas and berries contain antioxidants that protect sperm from damage. Green vegetables such as spinach and broccoli are rich in folate, which helps the body create new cells. Even simple habits like drinking enough water and limiting alcohol can make a difference. Alcohol, though commonly used for relaxation, can be a major enemy of male sexual health if consumed too often. It dulls the nervous system, decreases testosterone, and restricts blood flow. Heavy drinking over time can lead to erectile dysfunction and poor sperm quality. The same goes for smoking. Cigarettes damage the blood vessels, reduce oxygen in the blood, and harm sperm DNA. Men who smoke regularly often experience weaker erections and reduced fertility. Caffeine in moderate amounts is fine, but too much can increase anxiety and disturb sleep, both of which can lower sexual desire. Energy drinks, though popular, contain high sugar and chemicals that can disrupt hormones. The better option is to stay hydrated with water and natural fruit juices. Exercise, as mentioned before, is one of the best ways to improve sexual health, but not all exercises are equal. Aerobic activities like running, swimming, and cycling help the heart and improve circulation. Strength training raises testosterone levels and builds endurance. But balance is important. Overtraining or extreme workouts without rest can actually lower testosterone, because the body goes into stress mode. Rest days and proper sleep are essential for recovery. Even specific exercises like pelvic floor training, often called Kegel exercises, can improve sexual control and help with problems like premature ejaculation. These involve tightening and relaxing the muscles you use to stop urinating midstream. Practicing this for a few minutes daily strengthens those muscles and improves control during sex. Men also need to understand that stress is not just in the mind, it's physical too. When you are under constant stress, your body produces cortisol, the stress hormone, which blocks testosterone. Chronic stress keeps your body in a fight or flight mode, where reproduction becomes a low priority. That's why relaxation techniques such as deep breathing, meditation, yoga, or simply spending time in nature can significantly improve sexual health. Mental health plays a big role in sexual confidence. Many men feel pressure to perform perfectly every time, and this fear can actually make things worse. The body reacts to fear by releasing adrenaline, which tightens blood vessels and prevents an erection. The more a man worries about performance, the harder it becomes to relax and enjoy intimacy. The key is to focus on connection rather than performance. When a man feels emotionally safe, his body naturally responds better. Self-image also matters. If a man feels unhappy with his body weight or size, he might lose confidence. But confidence does not come from perfection, it comes from acceptance and taking care of yourself. Eating well, staying fit, grooming regularly, and dressing neatly all help build a positive self-image. When you feel good about yourself, your sexual energy naturally improves. Let's talk about hormones again. Testosterone is often called the male hormone, but it works alongside others like dopamine, serotonin, and oxytocin. These chemicals control mood, motivation, and bonding. When testosterone is low, a man might feel tired, irritable, or less motivated. Some men try to fix this quickly with supplements or steroids, but these can be dangerous. Artificial testosterone can shut down natural production and cause long-term damage to the testicles and heart. The natural way to boost testosterone includes sleeping enough, lifting weights, managing stress, and eating foods rich in zinc, vitamin D, and magnesium. Losing excess fat also helps because fat tissue converts testosterone into estrogen, lowering hormone balance. Men who reduce belly fat often see their testosterone rise naturally. Sexual health also includes the ability to reproduce. Fertility issues affect millions of men worldwide, and often, the cause lies in lifestyle. Sperm count and motility have dropped in recent decades due to pollution, stress, unhealthy diets, and chemical exposure. Simple things like avoiding tight underwear, not placing laptops directly on the lap, and keeping phones away from the groin can protect sperm health. Avoiding saunas or hot baths for long periods also helps keep the testicles cool. Fertility can be improved through diet and supplements. Foods with antioxidants such as blueberries, walnuts, and spinach help protect sperm from damage. Nutrients like coenzyme Q10, selenium, and folate are known to support healthy sperm. Staying physically active improves circulation to the reproductive organs, while maintaining a healthy weight keeps hormone levels balanced. Beyond physical health, men need to think about emotional intimacy. Many men separate physical pleasure from emotional connection, but sexual satisfaction often depends on both. Emotional intimacy means being honest, listening, and caring for your partner's comfort and feelings. When both people feel safe and respected, sexual experiences become more fulfilling and natural. Communication is often the most powerful tool. Talking openly about desires, limits, and preferences can remove confusion and fear. It also prevents misunderstandings and builds trust. When partners communicate clearly, they can explore safely and with more confidence. Consent is another essential part of sexual health. Every act must be based on mutual agreement and respect. Understanding and respecting your partner's boundaries is a sign of true maturity. A sexually healthy man values his partner's comfort as much as his own. In relationships, it's also important to remember that sex is not everything. Physical intimacy is just one way of connecting. Kindness, loyalty, humor, and emotional support build stronger bonds that lead to better sexual connection naturally. When love and respect are present, performance anxiety disappears because both partners feel secure. Another key topic is pornography and how it affects the brain. While occasional viewing may not cause harm, excessive use can create unrealistic expectations and reduce sensitivity to real-life intimacy. The brain gets used to constant novelty and artificial excitement, making it harder to feel aroused by real partners. This condition is called porn-induced erectile dysfunction and is becoming more common among young men. If this happens, the solution is to take a break from porn and allow the brain to reset. During this period, focus on healthy habits, real communication, and exercise. Over time, natural arousal returns, and the brain learns to enjoy genuine intimacy again. Technology can also be both a help and a harm. While phones and the internet give access to information and support groups, they also encourage constant screen time, late-night scrolling, and reduced physical activity. This combination of poor sleep and inactivity lowers testosterone and increases stress. Setting healthy boundaries with screens, like turning off devices before bed, improves sleep and hormonal balance. Let's discuss aging again. Many men fear losing their sexual strength as they grow older, but aging does not mean the end of intimacy. What changes is the way the body responds. Erections may take longer, recovery time may increase, and hormone levels may drop slightly, but these are natural processes. Regular exercise, good diet, and an active mind can delay these changes for years. Older men who stay mentally and physically active often enjoy satisfying sexual lives. Keeping romance alive through affection, humor, and shared experiences is more powerful than any pill. If physical issues appear, medical help is available. There are safe treatments for erectile dysfunction, from oral medicines to hormone therapy, but these should always be taken under a doctor's supervision. It's also essential to be aware of prostate health. The prostate is a small gland that produces semen fluid, and as men age, it can enlarge or become inflamed. Symptoms like frequent urination, weak flow, or pain can be early signs of prostate problems. Regular checkups can detect these issues early, and most are treatable if caught in time. Prostate cancer is one of the most common cancers in men, but when detected early, it's highly treatable. Men over 40 should consider talking to their doctor about screening, especially if there is a family history. A simple blood test called PSA can provide early warning signs. Good habits also protect prostate health. Eating tomatoes, which contain lycopene, and foods rich in vitamin E, like nuts and seeds, can reduce the risk of prostate issues. Regular ejaculation, whether through sex or masturbation, may also help keep the prostate healthy by flushing out old fluids and reducing inflammation. That brings us to masturbation, a topic surrounded by myths. Many men grow up hearing that it's harmful or shameful, but the truth is, masturbation is a normal and healthy part of male sexuality. It helps release stress, improve mood, and maintain prostate health. The only time it becomes a problem is when it replaces real connection, causes guilt, or interferes with daily life. Balance is key. Sexual health also includes safety and responsibility. Men should learn about contraception, understand how condoms work, and respect their partner's choices regarding pregnancy. Knowing how to prevent unwanted pregnancy is part of being a responsible adult. Sex education is often ignored or misunderstood, but every man should know the basics, not just for his own health, but also for his partner's. Understanding how the female body works, what consent means, and how emotions play a role in intimacy helps men build stronger, healthier relationships. One more point is self-examination. Just as women are advised to check their breasts for lumps, men should occasionally check their testicles for unusual swelling or pain. Testicular cancer is rare but most common in younger men. Early detection through simple self-checks can save lives. If you ever feel something abnormal, seeing a doctor immediately is important. Emotional well-being cannot be separated from sexual health. When a man feels secure, loved, and understood, his body naturally performs better. Loneliness, depression, or constant tension can lower libido and make it hard to function sexually. That's why seeking emotional support, therapy, or even open conversation with friends can be healing. Men are often taught to hide feelings and stay strong, but real strength includes the ability to talk and ask for help. Sexual problems are not signs of weakness, they are signs that your body or mind needs care. Just as you'd treat a fever or injury, you should treat sexual concerns with the same seriousness and self-respect. Every part of this discussion about what every man should know about his sexual health has been a journey into understanding the body, the mind, and the habits that shape a man's overall well-being. From the beginning, we learned that sexual health is not only about sex itself. It's about the balance between physical fitness, hormonal health, emotional stability, and mental peace. A healthy sex life starts with a healthy lifestyle. Eating clean, exercising regularly, sleeping well, and managing stress are not just general tips. They directly affect how the male body performs, responds, and feels. We also explored how important communication is, both with oneself and with one's partner. Many men avoid talking about sexual concerns due to shame or fear, but silence can make small issues grow into big problems. The truth is, the more we understand our bodies, the more control we have over them. Regular checkups, open discussions with doctors, and being aware of signs that something is not right are powerful steps toward prevention and early treatment. Another key part was emotional and psychological well-being. Sexual performance and desire are deeply connected to how a man feels inside. Confidence, reduced stress, and emotional connection with a partner play as big a role as physical stamina. Knowing that it's normal for libido and energy to change with age can help men approach these changes calmly and wisely. We also saw that harmful habits, like smoking, excessive drinking, poor sleep, or ignoring exercise, are some of the strongest enemies of male sexual health. On the other hand, simple, daily habits like staying hydrated, taking walks, maintaining a healthy weight, and focusing on positive relationships can make a huge difference. Finally, we understood that men's sexual health is not just about reproduction. It's about identity, confidence, and quality of life. The better a man takes care of himself, the stronger and more fulfilled he feels in all parts of life. Being informed, proactive, and honest with oneself is the real foundation of lasting sexual health. In the end, every man deserves to feel good about his body and his sexuality. It's not about perfection, it's about awareness, balance, and care. When a man takes charge of his health, physically, mentally, and emotionally, he not only improves his sexual well-being, but his overall happiness and confidence. Sexual health is lifelong, and it starts with one simple commitment to respect, understand, and nurture your own body every single day.